I think where Vista has really helped us is one, the fact that we have the data differentiates us with our payers. So when we walk into those contracting conversations, we're already head and shoulders above the competition because we're coming prepared. So that's one area that it helps us. Two, we've been in an environment the last several years where reimbursement rates are relatively flat relative to increases in operating expenses, particularly with behavioral health wages as there's more demand for this type of healthcare. That has really helped us be able to say to a few key payers like, hey, look, we know you're a little reluctant to sort of give us this increase, but if you don't give us this increase, this is what we have to give up. And this is where we can draw a correlation or causation between how this thing is important to the outcomes being measured. Instead of just speaking hypothetically, we're speaking in definitive factual terms. The third thing where it's really helped us is it's given us the confidence to enter into value-based agreements where we're able to realize some upside and some additional revenue as a result of the great work that we do. Because, in a value-based agreement, you have to take on some risk. Well, nobody wants to take on risk unless you understand the nature of the risk and you have a plan to mitigate that risk. And so, for example, we entered into a value-based agreement where if we hit certain, HEDIS measures, 7-day follow-up, 30-day follow-up, 30-day return to treatment rates, we were going to get additional increases for every single patient we treated the following year. Those incremental dollars are substantial. They fall directly to the bottom line. And where we're experiencing margin compression and it's so competitive for patients, that's a very important tailwind. So it gave us the confidence not only to enter into those value-based agreements, but we were able to produce outsized outcomes relative to the other people in the value-based agreements to the point where our HEDIS measures were 2 to 3 times our competitors. Once you decode your continuum of care and once you understand where your strengths are and where you need to pay a little more attention, it's a lot simpler than you think. It really is. You're not as far off from achieving clinical excellence as you may believe, but it all starts with measuring the outcomes, giving the outcomes to the people doing the work, right? Making sure you're practicing fidelity and then applying what you're learning along the way. But the reality is, what we learned from measuring our outcomes became a significant competitive differentiator. And so it was the most positive accidental decision I ever made as a CEO.